I am Dr. T. Ramani Devi from Trichy, Chairperson of Adolescent Committee of FOXY 2014-16 and Executive Committee member of Adolescent Committee of Suffolk. Here I would like to say a few words about adolescent endometriosis. 1 in 10 of women of reproductive age group, they suffer from endometriosis, and 2 to 3% of the endometriosis patients belong to adolescent category. Adolescents must be girls who are suffering from dysmenorrhea. They should be watched carefully because they can have endometriosis, and everybody knows very well that for the diagnosis of adolescent endometriosis, it may take even 2 years, starting from 2 years up to 9 years, and most of them they present with atypical features like chronic abdominal pain and dysuria, etc. And moreover, all the adolescent girls cannot be screened for endometriosis, so we should choose a group of adolescent girls who are at a high risk of developing endometriosis. Among that high risk category, one is I would like to enlighten about girl babies who are born who are having neonatal bleeding. They are at very high risk of developing endometriosis, so the mother should be cautioned about this. Then the next thing is girls who are suffering from severe dysmenorrhea, preventing them from entering school activities or social activities or participating from sports, or those who are having more than 18 days of school absenteeism for severe abdominal pain, they should be cautioned regarding the onset of endometriosis. And it takes roughly 2 to 9 years for them to get a proper diagnosis, and most of these adolescent girls they have mild to moderate form of disease, but still 1/3 of them who have endometriosis, they do belong to severe category. So the main aim of treatment of these girls is to reduce the pain, prevent fertility and prevent recurrence. So they should be screened, and probably by giving a questionnaire to all these school children, late teens and early college girls, we can segregate the high risk population and we can screen them. And we know very well that the imaging studies are not of much use in early endometriosis in adolescents, and still 1/3 of them they have severe endometriosis who can be picked up by MRI or ultrasound. So anyway, girls who have suspicion of endometriosis should be given a trial of oral contraceptive pills so that pain reduces, and they should be watched again. And once if they are found to have endometriosis, our aim should be to manage them medically, and surgery should be avoided in these girls. The indications for surgery is only when the pain is not responding to medical management, or when they have complications like rupture of endometrioma, or when they have doubts regarding whether the lesion is malignant or not. And then the medical management should be the first line of management. Apart from oral contraceptive pills, progesterones are turning as the first line of medical management for adolescent girls, and among the progestins we can Dyneges ranks the first, and there has been study, that is Visada study in adolescents, where they have used Dyneges for a period of more than 5 years continuously, and compared to GnRH analogs, this Dyneges doesn't have much of side effects in adolescents. But only thing is, the initial phase the girls may be having irregular menstrual cycle, and they should be cautioned about this. So anyway, when these girls are not responding to this sort of medical management, we have to go for surgical management, and the surgical management often it should be done by a senior consultant who is capable of treating the disease in a single sitting. So that is our idea, because as the surgery 1/3 of still the endometriosis patient, they have chance of getting repeated surgeries. So the first person who does the surgery should be experienced. So the final message I would like to say is, adolescent girls who are suffering from atypical abdominal pain, they should be cautioned about the onset of endometriosis, and they should be screened and treated by persons who have a special interest in endometriosis. Thank you.